There's a different underlying mechanism to causing type 2 diabetes. It's actually several different things that have to go on in the body in general that go wrong. And so we can attack each of those points differently with different medications. Things that help our body use insulin more, things that help to actually have the pancreas make more insulin in a more efficient manner. Things that help the liver, because that's a piece of the puzzle too. So we have a lot more avenues to take versus type 1 diabetes, where the insulin producing cells of the pancreas, called beta cells, are destroyed. You need insulin to live, so we have to give them insulin. However, if you have type 2 diabetes long enough, chances are pretty good you're going to need insulin, just because your pancreas kind of runs out of steam, and these other agents aren't always going to work for many years. But we have others who are on oral agents for decades who do very well. And there are a couple of classes of medications that have off-label use for that. We tend to not do so much off-labeling, but there are definitely pushes, if this is beneficial and it's not going to harm someone with type 1 who may have, a bit of insulin resistance or some urinary glucose loss, sugar loss in the urine, why not try to use this? So it hasn't been studied though, so there's interest and there is some use out there in the real world. But you have to sort of make sure that you understand fully how you're approaching the patient, have a really good understanding of all these medications and what could potentially go wrong. It's very exciting. It's one of the holy grails of diabetes management for type 1 patients specifically. And it's the idea that we can sort of build a bionic pancreas that would make insulin for folks and work just like our own pancreas would. There's some very interesting work being done also at the University of Virginia along this. So what it would do, it would function like a pancreas. It would check your blood sugar, essentially sense what's going on in the body and respond like mine would or someone without diabetes would. So there's a lot of very exciting work being done. It's hard to target a date. There's still quite a bit of research and understanding that needs to happen, but they've been making great strides in the production of this. The first step is actually what's called a closed loop system, where you would have some sort of glucose monitor that would sense the blood sugar and then communicate to a pump of insulin that you would not have to intervene on. So that's one of the big components of it. And then the artificial pancreas is probably several more years off, but the people who are working on it are doing some amazing things. It's interesting that you bring up insulin pumps. Insulin pumps are not closed loops, so it is an active process. And we do have a lot of type 2 patients that do use insulin pumps, but you still have to manage the pump. But a lot of this is living with chronic disease. And ultimately, I think people would want to foresee a time when people who have diabetes don't need any intervention. They can potentially have, a quote-unquote normal life with everything else. But even the folks that have it now, they can live long, healthy lives as long as they're educated about diabetes. They live a healthy lifestyle. They keep up with all of their monitoring and screening for long-term follow-up. It's still quite possible that you can have a long, healthy life with diabetes right now.